Dr. Siebel talked about how these were actually affecting the COVID mortality, but we are looking at it from a CVD perspective, cardiovascular disease perspective, and you would see here people with no diabetes or controlled diabetes versus people with uncontrolled diabetes. And if they do not have concomitant hypertension or dyslipidemia, the risk is about 2.5 times. But when they have all three together, and I want you to focus on here, it goes up to 3.3 times. The next in the line is actually the thing that Ganguly sir was referring to. It was about the use of tobacco. Now we always associated smoking with cardiovascular disease and chewing tobacco with oral cancer, but what we are finding in this particular study is that chewing tobacco is as hazardous or as risky as a behavior as smoking, and particularly in elderly ladies. And this is what we are finding through our study. They have a multiplicative effect of almost 2 times of having CVD-10 if somebody is using tobacco, either smoking or even chewing tobacco. Now, from cardiovascular, I want to move into the antimicrobial resistance return. And this is something which we are looking at after about analyzing 1,06,000 isolates from 2019 and 2020 from our different hospitals. I don't think there are parallel studies across the globe at this point of time which is looking at this extensive data set. And if you look at here, what we are observing, that the drug resistance organisms are not only prevalent in hospitals, but they are prevalent in the community and increasing at a rate of 4% every year. Whether it is in terms of MRSA or whether it is in terms of ESBL or non-fermented carbapenem resistance, we're seeing a very similar trend with that. So what we have been able to do is start an antibiotic stewardship program in Apollo hospitals to look at the patterns of this drug resistance and reduce their prevalence using syndromic approach, like an approach towards community-acquired pneumonia, and using recommendation system AIML tool and applying to what we call as the WHO AWARE program. But the focus of the program is to go and talk about it in the community and improve the community awareness. I want to go into another visualization, and this is the work that we did with across India, and I'm just showing you 2 cities where we mapped the ICD-10 coding system, which is the diagnosis of the patient. And here you can see chronic obstructive pulmonary disease with their PIN codes and merge them together to get the valuable data or information of where these patients are coming from. And we are also looking at another aspect, like where they're using the inhalers by using pharmacy data. And then on taking all of these data sets together, we look at the air quality index and build models which will predict if somebody is going to have acute exacerbation of COPD or asthma. And this is something that we have now rolled out into our ProHealth as well. There are other works that are going on, in particularly AIML usage in radiology. We are detecting intracranial bleed on the CT scan in 30 seconds and alerting the radiology. We are now able to extract coronary calcium scoring from standard CT scans and say about cardiovascular risk for somebody developing coronary artery disease. During the COVID time, we detected and highlighted lung abnormalities typical to COVID so that radiologists can report these X-rays quickly. Moving ahead, there are multiple clinical APIs that we are developing within Apollo hospitals. We talked about the AI-CVD risk score, which predicts the risk of CVD in the next 7 years. And then I talked about the asthma or the ACO complex, which predicts the acute exacerbation. We have a model which actually talks about liver fibrosis detection, looking at fatty liver and diabetes. And then, of course, I talked about the infectious diseases, where we are recommending amphotericin antibiotic for OP, IP, ICU. One of the important aspects of each one of these is they are all validated across different international institutes which are working as our partners. And then we have work that are there in pre-diabetes scanner. We have work that we are ongoing with heart failure, breast cancer mammography. This work comes from MIT. We are one of the Indian centers. We are one of the world centers, in fact, only Indian center, who are working to validate this model, and of course work on stroke risk. So if you look at it in a nutshell, they are developed in-house, integrated into EMR and the workflows. They look at individual patients' risk profiles and connect them to condition management system or clinical pathways, and more importantly, provide the current way of doing patient education. With this, I would like my colleague, Dr. Satya, to take over.
Thank you, Dr. Sujoy. It is truly my privilege to share with you this afternoon how we're going to shift the paradigm in India from a curative to a preventive mindset. As a country, we really need to accelerate this early identification and management of NCDs. You see here on the graph, the solid blue line, the probability of dying between the ages 30 and 70 from any NCD. And if we follow our current path, that's where we will end up in 2030. That's not sufficient. Every one of us needs to take charge of our own health, of the health of the people around us and our communities, in order to accelerate this path so that we're able to meet the sustainable development goal that we've committed to as a country, but more importantly, our responsibility to our families and to our nation. How are we going to do this? We actually built on the learnings of the total health case study that you heard from Professor Ganguly and piloted in 2019 ProHealth, a very unique, personalized, proactive health management program. This program is empowered by artificial intelligence and predictive algorithms. It builds on Apollo's pioneering efforts in preventive healthcare, 22 million health checkups over 37 years, and draws on the medical experts who have been involved in these health checkups who are committed to making you healthier. There are three principles and pillars that ProHealth is built on. First, predicting your risk. Every one of us is unique, and we have a personalized health risk assessment that takes into account your medical, personal, family, and environmental history and identifies and predicts your risk for NCDs. And coupled with AI-enabled risk scores for various conditions, this then becomes your health paths, benchmarking your personal health against others like you. The second pillar is about preventing the premature health events. Here what we do is actually personalize the health goals along with your physician, who takes all of the different factors into account and tells you what will actually make the most difference. And we support you through that path to wellness constantly. Finally, the third pillar on overcoming your chronic lifestyle disease. Our learning from Total Health says that if one is committed to that path, then it is indeed possible to reduce the risk over time, as long as one is diligent and stays the course. We analyzed a subset of ProHealth guests over the last 12 months who had diabetes and followed their path to wellness. What we found is across a number of health parameters, as well as behavioral changes, there was a 30 to 60% target achieved by this cohort. So the program can work as long as one is committed and stays on that path to wellness. Let me bring this to life with a case study. We had a 65-year-old female who enrolled in Apollo ProHealth in October 2019 and went through the personalized health risk assessment, and the health parameters and diagnosis was a combination of diabetes, arthritis, hypertension, and dyslipidemia. The guest also complained of knee pain. The AI cardiac risk score was 9, indicating a moderate risk for someone of that individual's history and age profile. Over time, the individual committed to a holistic wellness plan along with the physician and incorporated several aspects, including relevant diet, weight reduction, appropriate medication, yoga, and lifestyle changes. All of this was aided by the meticulous follow-up by health mentors as part of ProHealth, and also the knee pain was taken care of through a specialist consult. For 12 months, what you see on the right is a reduction in this individual's health parameters across HbA1c, sugar levels, weight, and BMI, essentially reducing their risk from where it was 12 months prior. This is the ProHealth promise. I'd like to invite our chairman to please share his vision for an NCD-free India.
Wish you all happy World Health Day. Anita, Dr. Anupam Sibal, Dr. Ganguly, Joy, and Satya are all clearly mentioned saying the data proves that there is another huge crisis that's depending on us. The 2020-2030 World Economic Forum almost 10 years ago projected that NCDs will cost almost 80% of the deaths all over. But what we have been trying from the time to see over the last 24 months, we have been working very hard to say, from a previous example, everybody knows Sapporo number one is curative medicine. But little did they know that we were working silently but very positively on preventive care, which is why we diagnosed what's called the mass child checkup then to find out why should a person get a heart attack. And especially as I don't know how many of you know, that Indian heart attack occurs between 30 and 50 as opposed to Caucasian between 60 and 80. And I presented to them, I was not a cardiology. They told me, Dr. Reddy, you just don't know the date of birth. I said, don't be foolish. They not only know the date of birth, they know the stars and those who are born. Then one day we realized in 1982, 7 years later, that 6 doctors didn't get up from the duty room. All of them were Indians. Then hell broke out and then said, they did study. First they said Indians eat a lot of beans. And then they said they eat a lot of coconut oil. And then they not only eat coconut oil food, but they also look all over the body, but they don't get into it. And now everybody prescribes coconut oil for improving the brain. I think this myth that Indians get heart attack early is now very clearly proven. Even 25-year-olds, 30-year-olds are getting heart attack now, similarly with the stroke. So I think the fear of whatever they have predicted, say by 2030, 80% of deaths will be from non-communicable disease. What are these non-communicable diseases? Diabetes, hypertension, cancer, infection, and obesity. Now, of course, we had mental disorder. I think the cardiac risk is the highest in all of these diseases because this is what causes the pain and grief in a family. But who is this 35-year-old? Who is this 30-year-old person? He is the one who is the breadwinner. He is the one who is contributing to the welfare of the organization is working. They are the people who are working for the GDP of the country. So I think little attention has been paid from these 3 angles which really should make the individuals to think, what can we do? How can we transform? How can we stop these NCDs killing 80% death? It is possible because I think Satya very clearly showed, and Dr. Ganguly beautifully brought out our total health program in the village I was born. We adopted 65,000 people from the first bed to the last bed. They have clearly shown when you monitor, when you advise them, when they get used to listening to you and adopting what you say, you can be reversed. You still probably get heart attack daily, but not at 35, not at 30. So this is where I think a great importance comes here on World Health Day. I wish the media, let's teach the world so that news gets to people saying, there is a way for me. Yes, I have diabetes, I have hypertension. I don't have to suffer from heart attack or a stroke. And cancer is detected early. Previously, cancers were death sentence. Now we have very clearly have shown that if you detect the cancer early enough, you can cure it. Even in my village, they detected last year about 18 cancers, 11 in women, 7 in men, all operated. So they are cancer free. So cancer is no longer a death sentence. Even the major conferences that took place in Chennai, when we opened breakout proton, they clearly said cancer is curable. What is needed is early screening, early detection, and cure. So I think there is a lot of message that we can give on this World Heart Day Day. World has to be should be a better place, not a place we should leave alone. You know, the World Economic Forum said the world will have to spend $30 trillion to treat this disease, and India's body is 3.8. I've been trying my very best last 20 years to see that the government spends 3 to 5% of the GDP, after 70% of US, but nothing happened because they have other priorities.